In this video, we're going to look at the respiratory system. So here we have a sagittal view of the head. To orient you, this is your frontal sinus of your frontal bone, the sphenoid sinus of the sphenoid bone, sella turcica just above that. This is the crista galli of the ethmoid bone. Now recall, you have the first cranial nerve set right here with an olfactory bulb on either side of this crista galli, and that crista galli is surrounded by a cribriform plate with olfactory foramina. So sensory fibers from those olfactory bulbs are descending through those perforations of the cribriform plate, and they're embedded in here, which is your superior nasal concha. If you look at this, this is your entire nasal cavity. These are your external nares, or what we commonly call nostrils. This is your superior, middle, and inferior nasal concha covered with nasal mucosa. So those fibers, those sensory fibers of the olfactory nerves are embedded in this nasal mucosa, and as we inhale something through our nose, those little particulates come in contact with those sensory fibers and they'll cause a depolarization event, and then that impulse will go to our olfactory cortex, which we then interpret as a scent or an aroma, an odor or fragrance, whatever the case may be. So these concha also cause the air to swirl around as we inhale through our nose, and the purpose is to bring that air in contact with the mucosa to humidify it and warm it before it enters our lungs, especially if you're out jogging in cold weather. As the air comes down, it passes through this area, which is your nasopharynx. Now, you have from here to here is your entire pharyngeal region, and it's subdivided into the nasopharynx, which is the direct posterior of the nasal cavity, the oropharynx, which is the direct posterior of the mouth in the back of the throat, and then the level of the larynx. Now this is your voice box, just like that, called the larynx. So in the direct posterior of the larynx is your laryngopharynx. This area, the nasopharynx, the oropharynx, are common passageways for air only when you're coming from the nasopharynx. But for the mouth, it's a common passageway for air, beverages, fluids, solids when we eat. However, we have this epiglottis here now that I've removed the thyroid cartilage. So this is part of your larynx, your thyroid cartilage, and this is what forms an Adam's apple on a man. Now, women have this thyroid cartilage as well, but testosterone has a greater influence on the development of the thyroid cartilage. So that's why, characteristically, men have a larger Adam's apple. So let's remove that. And you can see the epiglottis here now. As we swallow liquids or solids, this epiglottis will autonomically close, meaning it's not under voluntary control. It's part of the swallowing reflex to prevent food from aspirating into your lungs. That would be bad. So as we inhale, either through the mouth or through the nose, air will go through the epiglottis, through the vocal cords of the voice box, and down the trachea. This is just a little portion of your trachea. You can see the tracheal rings there. And the tracheal rings, along with most of your larynx, is all composed of hyaline cartilage. And then the primary bronchi will have hyaline cartilage as well. We'll see that in another model. But this is basically your upper respiratory system from here up. Here, in the posterior of the nasal cavity, known as the nasopharynx, we also see our adenoids. This is a set of tonsils. And this is the opening to your pharyngotympanic tube that you may have observed in the video on the ear, that eustachian tube, which opens up into your throat here. So if you sneeze, this is not a myth, but if you sneeze, air can escape through here. You don't really want it to, because it's a lot of pressure when you're sneezing, and it'll disrupt your tympanic membrane, or through your nose or through your mouth. So when sneezing, don't plug your nose or plug your mouth, because this is the only other avenue for the air to go, and that would potentially rupture the eardrum. So we'll look at a lot of this area when we do digestion. We'll look at the same model again. So in this next part, we're going to look at the rest of the respiratory system, including the lungs and the diaphragm, which you can already see in your field of view. So let's take a look at this and go over a few structures. With this model, we can see the larynx, our voice box, we looked at earlier, along with the trachea and the thyroid gland. These are the lungs, the right lung, the left lung. You'll notice the right lung has 3 lobes and the left lung only 2 lobes with this cardiac notch, because you can see the heart sitting there. Again, 2/3 left of midline, 1/3 to the right of midline. Now, if I remove these lungs, and if you're ever working with one of these models, these pins can get easily bent, so please be careful. These models are very expensive. So there's removing the left lung, and then the right lung. And now internally we see the lung tissue, the breakdown of the bronchial tree, the respiratory tree. In red we see the pulmonary veins we looked at in a different video on the heart, the pulmonary arteries in blue. Here's your heart. If we remove this, now we can see the trachea coming down, dividing into the right and left primary bronchi. You can even see it separating into secondary bronchi. A little bit of pulmonary vein coming back, pulmonary arteries going out. And here's your esophagus. This is your esophagus. So this would be lower respiratory, from about the level of your clavicle inward. If we look here, we see the diaphragm. This is a big dome-shaped piece of skeletal muscle under both voluntary and involuntary control. So when this contracts, it increases your overall thoracic volume, which causes a drop in internal thoracic pressure, and we inhale air. When we relax the diaphragm, it decreases the internal volume of the thoracic cavity. It increases thoracic, and by that I mean pulmonary pressure in this case, and we force air out of our lungs. So this is a voluntarily controlled muscle and involuntarily controlled. We don't think about breathing, it just happens. But at any given moment, you could hold your breath if you choose to. So there's your respiratory system overview. Here we're just continuing with the respiratory system. So this is looking at our respiratory tree. And if I turn this just slightly, you can see the thyroid cartilage again here. There's vascularization and musculature included here. And your thyroid gland. This is the gland that provides us with thyroxine, which maintains our basal metabolic rate. If I turn this back towards the anterior again, you can see now your trachea, and this is made of cartilaginous rings, hyaline cartilage, and then it subdivides into our right and left primary bronchi, then into secondary and tertiary, quaternary, and it'll go all the way down to the level of the bronchioles and the little alveolar ducts just before the alveolus, which is the actual structure of exchange. The lungs are the organs of gas exchange in our body, but the alveoli are the actual structures. You'll also notice that right here you see the hyaline cartilage becoming more sparse, and by the time we get down to the level of the alveolar ducts, there is no more hyaline cartilage present. Now, I'm going to take this out of this stand, and I'm going to move it a little closer so you can see the internal structure here. So here is your epiglottis, right here, that we saw in the other segment of the video, that will close off this area when you're swallowing liquids or beverages. And then right here are your false vocal cords and your true vocal cords. So as we speak, air comes out of our lungs and it vibrates these vocal cords, and the tones that we make, the pitch that we make, is dependent on how tight or loose these cords are. So where these two cords, there would be another half here, and where they would come together, and I'll see if I can actually show you that. Okay, so we're back. And if you look, you can see those white cords inside forming a V. So those are your vocal cords, your true vocal cords. And the space between those vocal cords is the glottis. Remember, this is the epiglottis we saw earlier. So it closes off the glottis so that we don't aspirate food into our lungs. Right? But there are your vocal cords, your glottis, again your epiglottis. This is a posterior view of your larynx, your voice box. And then again we can see the Adam's apple from the thyroid cartilage, the thyroid gland right here. All right? And this is your hyoid bone. So again, larynx, trachea or windpipe, and what we saw earlier.